It looks like Silicon Valley, but it's the University of Maryland Medical Intelligent Imaging Center, where doctors and scientists are kicking around big ideas and asking important questions about the impact of artificial intelligence and machine learning on medicine. For example, is ChatGPT a good way for patients to access medical information? But you may be asking, what is ChatGPT?
ChatGPT is more or less the whole scope of the internet, where it's taken and scraped knowledge from Wikipedia, from Google, from Amazon. It's sort of like a data bank. We ask it questions in a conversational way, and it gives us an answer that reflects all of that data.
But are the answers reliable when it comes to medical topics like breast cancer? To find out, investigators analyzed ChatGPT responses to 25 common questions.
The most basic question we might ask about breast cancer is, what is my risk for breast cancer? Let's see what ChatGPT has to say. All right, it's thinking. All right, so this is good. It's giving a disclaimer about its limitations. It can't tell you about your personal risk for breast cancer, but it can give you these general risk factors, things like age, family history of breast cancer, lifestyle factors.
As part of the study, the responses were evaluated for accuracy by a panel of breast radiologists.
Somewhere close to 90% of responses were actually appropriate, which was a good thing. But that 10% that were not appropriate, either ChatGPT gave inconsistent responses, meaning if you asked it on any given day, you'll hear different answers that often contradicted each other, or the responses were just flat out wrong.
There's also concern about the possibility of ethnic or racial bias in the responses.
So you can imagine you put in the same patient scenario, but you take out a different race or put in a different race, the recommendations may be totally different.
While ChatGPT shows a lot of potential as a health education tool, Dr. Yi doesn't believe it's ready for prime time just yet.
And there's a lot of work that needs to be done that I think requires collaboration between computer scientists like at OpenAI who developed ChatGPT, as well as with doctors who can say like, hey, if we're gonna roll this out and let patients use it, we need to make sure there are these guardrails.
For the University of Maryland School of Medicine, I'm Larry Roberts.